Welcome to this educational lecture on the levels of cervical lymph nodes. In this presentation, we will discuss the site, anatomical boundaries, and drainage areas of the cervical lymph node levels. Understanding these lymph node levels is extremely important for clinical examination, radiological interpretation, and surgical management of head and neck cancer. Cervical lymph nodes follow a predictable anatomical pattern of drainage. To simplify communication between clinicians, these nodes are divided into standardized anatomical levels. This classification allows surgeons, oncologists, and radiologists to describe the precise location of lymph node involvement. It also helps in predicting the pathway of tumor spread, planning neck dissection surgery, and determining the stage of head and neck cancers. The boundaries of cervical lymph node levels are defined using several important anatomical landmarks in the neck. These landmarks include mandible. So this is mandible. This is an important landmark because it gives us the location of submental nodes, which will be somewhere here. So these include the mandible, digastric muscles. This is digastric muscle, anterior belly of digastric muscle, and then posterior belly of digastric muscle, sternocleidomastoid muscle, and then hyoid bone. This is hyoid bone, and then cricoid cartilage. Cricoid cartilage is lying here under or below the thyroid cartilage, and these boundaries of cervical lymph node levels are defined using several important anatomical landmarks in the neck. These landmarks include, as I told you earlier, mandible, digastric muscles, and then sternocleidomastoid muscle, and then hyoid bone. This is hyoid bone, I told you, and then cricoid cartilage and clavicle. So by identifying these landmarks during clinical examination, imaging studies, and surgery, clinicians can accurately determine which lymph node level is involved. So this is the overview of cervical lymph node level. This is the overview of cervical lymph node level. Cervical lymph nodes are divided into 6 major anatomical levels. Level 1 include submental and submandibular lymph nodes. So this is submental, which will be known as level 1A, and this is submandibular lymph nodes, which is also known as submandibular lymph nodes. Level 2, 3, and 4 from the deep cervical lymph node chain along the internal jugular vein. So here this is sternocleidomastoid muscle, and under this sternocleidomastoid muscle there will be internal jugular vein, and these lymph nodes, that is the level 2B, level 2A, and then level 3. These are the level 3 lymph nodes, and then level 4 lymph nodes. So these lymph nodes lie around the internal jugular vein. So level 2, level 3, and then level 4, they lie along the internal jugular vein. Level 5 nodes lie in the posterior triangle of the neck. So you see, this is the posterior triangle of the neck, which is formed by the posterior border of the sternocleidomastoid muscle and the anterior border of trapezius muscle, and below is the clavicle. So this triangle is known as posterior triangle, and the lymph nodes in the posterior triangle will be some lymph nodes here, and then some lymph nodes will be here. That this level will be known as level 5A, and this level will be known as level 5B. So level 5 will be lying in the posterior triangle of the neck. Finally, level 6 nodes lie in the central compartment of the neck between the carotid arteries. So, in the central compartment of the node, level 6 will be lying. This is level 6, and this level 6 will be lying in the central compartment of the neck. So this slide is showing us level 1 lymph nodes. Level 1 lymph nodes are, as I told you earlier, that they are located in the submental. This is submental area and this is submandibular region. So the lymph nodes which are lying under the mandible in the submental region and in the submandibular region will be known as level 1 lymph nodes. The submental and submandibular the submental region will be labeled as level 1A and the submandibular region will be known as level 1B. So these levels are divided into level 1A and level 1B lymph nodes. Level 1A lie in the submental region and the lymph nodes are known as submental nodes, and this level lies between the anterior belly of digastric muscles, and level 1B is the submandibular nodes. They lie around the submandibular gland beneath the body of mandible. So if this is the body of the mandible, if you poke your fingers under the body of the mandible, you will feel these submandibular lymph nodes if those lymph nodes are enlarged. So this is level 1 and level 1A and level B. Now we discuss the area of drainage of level 1A and level 1B. So these nodes drain structures such as lower lip, chin, anterior floor of the mouth, and the tip of the tongue. They are commonly involved in oral cavity cancer. Now, the level 2 lymph nodes are also known as the upper jugular lymph nodes. So they are lying in the upper part and around the internal jugular vein. So these lymph nodes will be known as level 2 lymph nodes. These lymph nodes are highlighted by yellow color and they are lying, as I told you earlier, on the upper part of the internal jugular vein. This is internal jugular vein, this is its upper part, and at this part these level 2 lymph nodes, level 2A and level 2B lymph nodes are present. Level 2 nodes are among the most frequently involved lymph nodes in head and neck cancers, especially tumors of the oropharynx and tonsillar region. So the level 2 lymph nodes, they drain nasopharynx, oropharynx and tonsils. So this level is also having, this level has boundaries, and the superior boundary is made by the skull base and the lower boundary of level 2 lymph nodes will be formed by the hyoid bone. Now, level 3 lymph nodes. Level 3 lymph nodes are called the middle jugular nodes. This green area is showing level 3 lymph nodes, and this level 3 lymph nodes are called the middle jugular nodes. They lie along the middle segment of the internal jugular vein between the hyoid bone above and the carotid and the cricoid cartilage below. So this middle jugular group of lymph nodes lie along the middle part of internal jugular vein, and these nodes receive lymphatic drainage from the structures including the oral cavity, tongue, larynx and hypopharynx. Now, level 4 lymph nodes are also known as the lower jugular lymph nodes. The green part is showing the lower portion of the internal jugular veins. Level 4 lymph nodes are also known as lower jugular nodes. They lie along the lower portion of internal jugular vein, extending from the cricoid cartilage down to the clavicle. So this is clavicle, and this group of lymph node is starting from the lower border of cricoid cartilage. This is cricoid cartilage, and these group of lymph nodes lie between the cricoid cartilage and the clavicle. They may also occasionally receive metastasis from thoracic or abdominal malignancies, particularly on the left side of the neck through the thoracic duct. So the area drained by the lower jugular nodes is larynx, hypopharynx, thyroid gland, and cervical esophagus. As I told earlier that the level 5 lymph nodes are located in the posterior triangle of the neck. The posterior triangle of the neck is bounded anteriorly by the sternocleidomastoid muscle, its posterior part, and the anterior part of the trapezius muscle. This is trapezius, this is sternocleidomastoid muscle. Posterior border of sternocleidomastoid muscle makes the anterior boundary of this posterior triangle, and the anterior border of trapezius muscle is making the posterior wall of this triangle, whereas the lower portion of this triangle is made by the clavicle. So this group of lymph node is also known as posterior triangle lymph nodes or level 5 lymph nodes. This triangle is bounded, as I told you earlier, anteriorly by the sternocleidomastoid muscle. These lymph nodes are frequently involved in nasopharyngeal carcinoma. So these level 5 nodes drain nasopharynx, scalp, and posterior neck skin. So level 5 lymph nodes receive lymphatic drainage from the nasopharynx, scalp, and the skin of the posterior neck. They are frequently involved in nasopharyngeal carcinoma and malignancies of the scalp. So enlarged lymph nodes at level 5 can be one of the earliest presentation of nasopharyngeal carcinoma. Level 6 lymph nodes lie in the central compartment of the neck. So this is central compartment of the neck, which is formed by the trachea mainly, then cricoid cartilage, and then thyroid cartilage. So this anterior segment of the neck contains level 6 lymph nodes. Level 6 lymph nodes are located between two carotid arteries and extend from the hyoid bone above to the suprasternal notch below. So this is hyoid bone, this is suprasternal notch, this is central portion of the neck, and this portion or the central portion of the neck is containing level 6 lymph nodes. So level 6 nodes are particularly important in thyroid cancer, where lymph node metastasis commonly occurs in the central compartment. Level 6 lymph nodes also drain larynx, trachea, and cervical esophagus besides thyroid gland. So these lymph nodes are enlarged mainly in carcinoma of thyroid gland, carcinoma of larynx and trachea, and cervical esophagus. Head and neck cancers usually spread to predictable lymph node levels. For example, oral cavity cancers commonly metastasize to level 1 nodes. Oropharyngeal cancers frequently spread to level 2 lymph nodes. So this is level 1 lymph nodes, and the oral cancers are commonly drained into this group of lymph nodes, whereas the oropharyngeal cancers frequently spread to the level 2 lymph nodes. Laryngeal cancers typically spread to level 2, 3, and 4. So this level 2, level 3, level 4, these group of lymph nodes drain the cancer of larynx. In contrast, thyroid cancers most commonly metastasize to level 4 lymph nodes. If thyroid is having cancer, so this cancer is metastasized to level 4 lymph nodes. Recognizing these patterns is extremely helpful in assessing and in staging the cancer cases. So, the oral cavity spreads to level 1, oropharynx spreads to level 2, larynx spreads to level 2 and 4, and thyroid cancers spread to level 6. In summary, cervical lymph nodes are divided into 6 anatomical levels based on important landmarks in the neck. Each level has specific boundaries and characteristic drainage areas. A clear understanding of these lymph node levels is essential for diagnosis, cancer staging, radiological reporting, and surgical management of head and neck diseases. Mastering this classification greatly improves clinical accuracy and surgical planning.